All right, everyone get ready. Because today we are going deep on something that might make some people a little uncomfortable, maybe even squirm a bit.
Oh, yeah.
We're talking about buried penis in infants.
Yeah.
Now, before anyone freaks out, it's really not as scary as it sounds, is it?
No, not at all. In fact, it's more common than a lot of people might think, especially after circumcision.
Okay, so let's start with the basics. When we say buried penis, what does that actually mean? Does it mean the penis is, like, small?
That's a great question. And actually, size isn't really the issue at all. A buried penis is a normal-sized penis that's just kind of hidden, under some extra skin and baby fat. It might look like it's kind of sunk in a little bit.
So it's more of a visual thing, not a problem with the, penis itself.
Exactly. And we did a ton of research for this deep dive. We looked at medical publications from places like Lurie Children's Hospital, Cleveland Clinic. There's even a study published in the Journal of Urology. And they all seem to agree that in most cases, this is really just a cosmetic issue.
That's good to hear. But I'm guessing there are times when it could actually be more of a problem, right?
You're right. You're catching on quick. While a lot of cases do resolve themselves as the child grows, there can be complications if it's left untreated. We'll get to those a little later. But first, let's talk about what causes this whole buried penis thing in the first place. I mean, why does it even happen?
Well, one of the things that our sources point to is circumcision. Does that sound right?
Yeah, it can be a factor, but it's not necessarily circumcision itself that's the issue. It's really more about how the circumcision was done that matters.
So like a botched circumcision can lead to a buried penis.
Yeah. It's kind of like, think of it this way. If too much skin is removed during the procedure, it can create a tight scar. And that scar can actually pull the penis inwards. But on the other hand, if not enough skin is removed, then you end up with like a flap of skin that covers the head of the penis. It's almost like, I don't know, like trying to wear a shirt that's either way too small or way too big.
Okay, I like that analogy. And speaking of fit, I know our sources also mentioned baby fat as a possible culprit.
Yeah, absolutely. Babies have, they naturally have that pad of fat in their pubic area, and sometimes it can engulf the base of the penis, which makes it look buried. The good news is that this usually resolves on its own as the baby grows, and that fat kind of redistributes.
So we've got circumcision technique, chubby babies. Are there any other things that can cause this?
You bet. Sometimes babies are just, I guess you could say, born with certain anatomical variations that make them prone to having a buried penis, even before circumcision, like things like loose ligaments or extra skin attachments. These can cause the penis to retract inwards.
And we can't forget about post-circumcision care. I mean, that's got to play a role too, right?
You are so right. Even if a circumcision is done perfectly, what happens afterwards is really important. If the skin isn't retracted regularly, it can lead to what we call adhesions. It's basically the skin sticking to the head of the penis.
Oh, that doesn't sound good. So it sounds like a lot of things can contribute to this. But I'm hoping there are treatments available. What can be done about it?
Well, this might surprise you, but in a lot of cases, the best course of action is actually to just do nothing.
Wait, really? Just let nature run its course?
Yep. Studies show that over 90% of these cases actually resolve on their own by the time the child is 3 years old.
Wow. Okay, that makes me feel a lot better.
Yeah.
It sounds like most of the time, this really isn't something to stress too much about.
Yeah.
But what if waiting isn't an option? Like, what if a parent is really worried or, the buried penis is causing some problems? What then?
Well, that's when we start looking at some treatments. And, the approach we take really depends on a few things. How severe it is, the age of the child, and whether it's actually causing any problems.
So there's no, one-size-fits-all solution here.
No, not really. Sometimes it's simple things, like if the baby is on the heavier side, managing their weight can help. Of course, we're not talking about putting an infant on a diet or anything like that. It's more about making sure they're growing at a healthy pace.
Okay, that makes sense. Now, what about those adhesions we talked about? Are those easy to take care of?
They can be. Sometimes they even resolve on their own. And one little trick that parents can use is applying a little bit of petroleum jelly to the area.
You mean like Vaseline?
Yep, just plain old Vaseline. It sounds too simple to be true, but it can really work wonders to prevent that skin from sticking. And if the adhesions are being a bit more stubborn, a topical steroid cream can help to soften the scar tissue and free up the penis a little bit.
So Vaseline, it's not just for chapped lips anymore.
Yeah.
But I'm guessing keeping the area clean is super important too, right?
Oh, absolutely. Keeping things clean and dry down there is key. One little trick is to gently press down on the fat pad during diaper changes, just to make sure you're getting every little nook and cranny.
Okay. All of this sounds pretty manageable so far. But what about when those simple solutions just aren't enough? I know our sources mentioned surgical interventions. When does that become necessary?
Well, surgery is usually considered a last resort. We typically only go that route if those conservative measures we talked about haven't worked or if there are other problems going on.
Oh, what kind of problems?
Well, for example, if the child is older and the condition is persisting, or if they're having recurring infections or trouble peeing, surgery might be the best option.
Okay, that makes sense. So what types of surgeries are we talking about here?
Sometimes it's a pretty simple procedure, like a little revision to the original circumcision. This could involve removing some extra skin or scar tissue that's causing the problem.
Kind of like a do-over.
Yeah, exactly. But in some cases, more complex cases, a more involved repair might be necessary. Things like removing excess fat, securing the penile skin, or even tightening those loose ligaments we talked about earlier.
So there are options depending on, the specifics of each case.
Right. And the good news is that these surgeries are usually outpatient procedures, which means the child goes home the same day.
Okay, so no overnight hospital stay.
And with proper care, most kids bounce back pretty quickly.
That is good news. So overall, it doesn't sound like surgery is something that parents need to worry about right away.
No, not at all. Most of the time, this can all be managed with a little patience and some simple at-home care.
Okay, phew. I'm feeling a lot less anxious about this whole buried penis thing now. But we haven't really talked about how to prevent it in the first place, have we?
That's a great point. We've touched on it a bit, but let's dig into those preventative measures a little more in the next part of our deep dive.
All right, sounds good. Let's do that after a quick break. So before the break, we were talking about how to prevent this whole buried penis thing in the first place. What's the most important thing?
Well, one of the most important things is, especially after circumcision, is that manual retraction technique we talked about.
Right, gently pushing back the skin on the penis. But is it really that important?
It might seem like a small thing, but honestly, it makes a huge difference. It's kind of like, how stretching keeps your muscles flexible and prevents them from getting tight?
Uh-huh.
It's the same idea with the skin on the penis, Gently retracting it keeps things nice and loose, and it can help to prevent those adhesions from forming.
So it's all about maintaining good range of motion, even for a baby's penis.
Exactly.
And I remember you saying that petroleum jelly is a parent's best friend when it comes to this.
Oh, absolutely. Applying a little bit every day, especially in those first few weeks after a circumcision, really helps create a barrier so that the skin doesn't stick to the head of the penis.
Okay, so gentle retraction plus Vaseline equals a happy, healthy penis.
You got it.
But that all sounds very specific to circumcision. What if a baby isn't circumcised? Do parents still need to be, doing all of that?
Well, that's where things get a little, I guess you could say, a little trickier. Routine retraction might not be necessary for uncircumcised babies, but there are definitely some things that parents and caregivers should keep an eye out for.
Okay, like what?
Well, pay attention to how your baby pees. If you notice them struggling, or if the urine is spraying in a weird direction, it could be a sign that something's not quite right.
So any weirdness in the pee department, and it's time to call the doctor.
Exactly. And, another thing to watch out for is those recurring diaper rashes or infections in that area. If you're noticing those popping up pretty often, it could be a sign of a buried penis that's causing some, hygiene problems.
So pee problems and frequent rashes. Got it.
Yeah.
But let's say, a parent notices these things and they take their baby to the doctor. What happens next? Do they immediately go into surgery?
Oh, not at all. Remember, most of the time, that watchful waiting approach is all that's really needed. And even if we do need to intervene, there are lots of those non-surgical options to try first.
Okay, this whole watchful waiting thing is, kind of surprising to me. How effective is it, really? What if a parent is really, really worried? Or it's just not budging? When is it too long to wait?
It's totally understandable for parents to be anxious, and I think communication with your doctor is key here. Most experts agree that if the buried penis is causing problems or it hasn't resolved itself on its own by adolescence, then it should be addressed. But even then, surgery isn't always the answer.
So what else can be done?
Well, we talked about topical steroid creams and the petroleum jelly for those adhesions. And sometimes, if excess weight is a factor, just helping the child maintain a healthy weight as they grow can be enough to fix the problem.
Okay, so it sounds like a lot of these solutions are pretty straightforward. Are there cases where it's a little bit more complicated?
Oh, sure. There are definitely some cases where, the anatomy is a bit more complex, and those might require a more, individualized approach.
What do you mean by complex anatomy?
Well, sometimes there might be extra skin, between the penis and the scrotum, or the ligaments that hold the penis in place might be a little looser than usual. So in those situations, surgery might be necessary to correct the underlying issue.
Okay, so it's all about figuring out what's causing the buried penis and then choosing the treatment that, best addresses that specific cause.
Exactly. And the good news is, even in those more complex cases, the long-term outlook is generally really positive. Studies show that once the penis is corrected, whether it's through those conservative measures we talked about or through surgery, there's really no negative impact on their sexual function or fertility later in life.
That is really reassuring. So even if the journey is a little bit longer or more complicated, the end result is usually a happy, healthy penis.
That's exactly right. And I think it's worth mentioning that, for some parents, the emotional side of this can be just as concerning as the physical side. It's their child's body we're talking about here.
That is a really good point. It's definitely a sensitive topic, and I'm sure a lot of parents worry about, how this might affect their child psychologically. What do our sources say about that?
Well, they stress the importance of open communication and creating a supportive environment. If your child's old enough to understand, talk to them about what's going on in a way that's appropriate for their age. Reassure them that there's nothing wrong with them and that, this is something that a lot of kids go through.
That makes sense. But what about those early years when they're just, too young to really understand what's happening?
Even then, you can create that sense of safety and security by being gentle and reassuring during diaper changes and, during any treatments that they might need.
So basically just being a loving and supportive parent.
Exactly. And if you're feeling overwhelmed or unsure about anything, don't hesitate to reach out for professional help. There are lots of therapists and counselors who specialize in helping families navigate, these kinds of challenges.
That's great advice for any parenting situation, really. Now, before we wrap up this part of our deep dive, I want to go back to something we haven't talked as much about. Those cases where a baby is born with a buried penis. I feel like we've focused a lot on circumcision, but what about those situations where it's, present from birth?
Yeah, that's an important distinction, and it definitely changes how we approach it.
How so?
Well, if an infant is born with a buried penis, it's often recommended to hold off on circumcision and consult with a specialist, at least for a little while.
What kind of specialist?
A pediatric urologist would be the best person to assess the situation and recommend the, best course of action. Sometimes that buried penis might actually resolve on its own as the baby grows, so circumcision may not even end up being necessary.
So it's really about, taking a cautious approach and getting an expert opinion early on.
Exactly. And that brings us to another really important point: choosing a qualified and experienced healthcare provider.
Okay. That sounds like a good place to pick up in the next part of our deep dive. We'll talk about finding the right doctor for this after a quick break. All right, so we were talking about how important it is to, find the right doctor if you're dealing with this whole buried penis thing, especially in those cases where it's, present from birth. So how does a parent go about finding that perfect expert?
Well, you bring up a really good point. It's not just about finding any doctor. It's about finding someone who really specializes in, this specific area.
So we're talking about a pediatric urologist, right?
Exactly. These are the doctors who have specialized training in dealing with, all sorts of urinary and genital issues in kids. They've seen it all, and they know how to handle even the most, complicated cases.
That makes sense.
Mm-hmm.
But how do you actually go about finding one? Is it, as simple as just doing a Google search?
Well, a Google search is a good place to start, I guess, but you really want to make sure you're finding someone with the right credentials and experience,
Okay, so what should parents be looking for?
Well, first and foremost, you want to make sure the doctor is board certified in pediatric urology. This means they've gone through, tons of training and passed a really thorough exam, so they're qualified.
Okay, board certified, check. Anything else?
It's also a good idea to look for a doctor who has, specific experience with buried penis. Some pediatric urologists might have more expertise in this area than others.
Right, so maybe someone who works at a children's hospital or a specialized clinic or something like that.
Exactly. Those are great places to start. And, don't be afraid to ask your pediatrician or other healthcare providers that you trust for referrals.
Yeah, word of mouth is always good. It sounds like finding the right doctor is half the battle here. But once you've found that perfect expert, what happens next? What can a parent expect at that first appointment?
Well, the doctor's going to want to get a really thorough history of the situation, so Be prepared to answer questions about when you first noticed it, whether it's causing any problems and what treatments you might have already tried.
So basically, the more information you can provide, the better.
Exactly. And then, of course, the doctor will do a physical exam to assess the situation. They'll look at the anatomy, check for any adhesions, and just see if there are any other underlying issues going on.
And based on that, they'll come up with, like, a treatment plan.
Exactly. And remember, there's no one-size-fits-all approach. It all really depends on your child's specific needs.
Okay, so we've talked about finding the right doctor and what to expect at that first appointment. Is there any other, I don't know, advice that you have for parents who are going through this?
Yeah, I think one of the most important pieces of advice I can give is to be your child's advocate.
What do you mean by that?
Don't be afraid to ask questions, to express your concerns, and even seek second opinions if you feel like you need to. Remember, you know your child best, and you have every right to be involved in every single step of the decision-making process.
That's so important. It's easy to feel, I don't know, intimidated in those medical settings. But at the end of the day, you're the parent, and you have a voice.
Absolutely. And along those same lines, don't be afraid to lean on your support system, Talk to your partner, your family, your friends, anyone you trust. Sharing your worries and getting support from others can make a huge difference.
Yeah, it's true. A problem shared is a problem halved, or so they say. And speaking of sharing, I'm guessing there are some resources out there for parents who are feeling, lost or alone in all of this.
Oh, you bet. There are tons of amazing online forums and support groups where parents can connect with each other, share their experiences, get advice. We'll be sure to include links to some of those in the show notes for this episode.
Great. And, I want to say again what you said earlier. If you're feeling overwhelmed, don't be afraid to seek out some professional help. Get our therapists and counselors who, specialize in helping families deal with this kind of stuff.
Absolutely. They can give you guidance, support, and some good coping mechanisms to help you and your child, get through this.
So it sounds like we've covered just about everything there is to know about buried penis in infants. We talked about the causes, the treatments, the potential complications, even how to find the right doctor.
Yeah, and we talked about how important it is to be open and communicate with your child, be their advocate, and just, seek support when you need it.
We really hope this deep dive has given everyone listening the information and resources they need to feel, empowered and confident if they're dealing with this, sometimes confusing condition.
Remember, even though it can be concerning, a buried penis is a manageable condition. And with the right care and support, most kids go on to live perfectly healthy and happy lives.
Thank you for joining us. We'll see you next time for another deep dive into a topic that matters.